I remember sitting in the ambulance, but I don't remember a whole lot after that. They tell me I coded in the ambulance. I remember waking up and seeing Dr. Bridges and him asking me a few questions.
And as we were having our discussion, her heart actually stopped right in front of us, and we actually had to shock her, had to reset her heart, put her back into rhythm, and rush her to the cardiac catheterization lab.
My name is Lisa Marston, and I live in York, Maine. I was 39 years old, single mother. I realized now I had symptoms. I don't think I realized before my heart attack, and woke up in the middle of the night, had nausea and back pain. It got severe enough where I knew I couldn't ignore it. So I called 911. They arrived on the scene.
As an interventional cardiologist, when somebody suffers a heart attack, you're never really surprised. But Lisa's story is quite unique. Anytime somebody has a heart attack, they present to emergency room. The emergency room calls out a stat page. So I remember receiving that page and arriving in the emergency room expecting to see the normal 50 to 60-year-old individual who has a heart attack. Quite to my surprise, I found a 30-year-old woman, a mother, who was in tears and suffering a massive heart attack. The heart just had no function whatsoever. She was in cardiogenic shock. She was having arrhythmias. We were able to unclog the artery, put in a stent, and then start rapid medical treatment to recover as much heart function as we possibly could.
I was in ICU for maybe 2 days, if that, and then they put me up on the floor for a week, and then I did, I believe, 4 weeks of cardiac rehab with York Hospital. They were wonderful, very caring and kind and attentive, and the care from Dr. Bridges was amazing. He put my whole family at ease, not just me. I think that's really important, that they look out not only for you, but for your family too. It is amazing what they do and how they save people's lives every day.
There are 3 other interventional cardiologists besides myself that work here at York Hospital. We're on 24 hours a day. We just have some really great operators offering really advanced care, and it's really impacting people's lives.
I want to thank the cardiology team at York Hospital for saving my life. I can't be thankful enough that this hospital is in my community.